Hello everyone, this lesson will learn the disease of retina briefly. The human retina is a high organized structure. The layered organization allows for localization of function or functional balance to a single layer or group of cells. The perception of color, contrast, depth, and form occurs in the cortex. In adults, the aura scala is about 6.5 mm behind the subvised line on the temporal side and 5.7 mm behind it nasally. Physiology. The photoreceptors are arranged such that there is an increased density of cones in the center of the macula, decreasing to the papillary, and a higher density of rods in the papillary. In the fovea, there is a nearly 1:1 relationship between each cone photoreceptor, its ganglion cell, and the emerging nerve fiber, whereas in the parallel retina, many photoreceptors connect to the same ganglion cell. The fovea is responsible for good septal resolution. The fovea is responsible for good septal resolution and color vision, both requiring high emitter light and being best at the fovea, while the remaining retina is utilized primarily for motion, contrast, and night vision. The retina can be examined with a direct or indirect ophthalmoscope or with a slight map and contrast or handheld biomicro lens. This allows identification of the type, level, and extent of retinal disease. Retinal imaging are useful adjuncts to clinical examination. Retina imaging techniques enabling identification of anatomical, vascular, and functional abnormalities. They include fundus photography, fluorescence angiography, optical coherentography, endocrine grain angiography, and autofluorescence, viral electrophysical and physicalized test, ultrasound, CT, MRI, and X-ray. Two kinds of digital fundus photography, standard and wide field, can examine the posterior fundus and the filiary of the retina. The filial retina is the site of many retinal diseases, which are difficult to detect with conventional imaging devices, including retinal tears and detachments, proliferate diabetic retinopathy, uveitis, and choroidal tumors. Wide field imaging for paralytic patients is also available in the surgical site using the RetCam 2 instrument. OCT. This rapid, non-instant imaging technique is capable of producing cross-sectional imagings of the human retina with extremely high. This level of detail is critical to the early detection of the vascular occlusion, macular holes and membranes, macular edema, and fluid accumulation due to damaged blood vessels from diabetic retinopathy and age-related macular degeneration. OCT is also used to monitor ongoing response to treatment. Retina has 13 layers in OCT from inner to outer, and the outer retina has 3 more layers. They are mild zone, epizone zone, and interdigitation zone. FA and ICG. This technique illumines the retinal blood vessel using an intravenous injection of cord dye. Rapid sequence of photographies or high-speed layer scans can capture the filling of blood vessels and retinal defects in the walls, or the presence of abnormal capillaries. The patterns of blocked or leading blood vessels help identify the nature of the retinal disorder. This technique is available on a variety of instruments and formats, allowing the physician to choose the device best suited for the suspected area of the retina involved. Ultrasound for large structures and in cases of opacity of the vitreous. Ultrasound provides a non-invasive window into disorders of the retina, vitreous, and choroid. These include vitreous hemorrhage, tumors, intraocular inflammation, and infection. Electro-ophthalmology. Disorders in the electric response of rod and cone photoreceptors to light stimulation are identified using full-field electro-retinography, electro-oculography, virally evoked potentials, and dark adaptionary. Many of the disorders diagnosed with these instruments are hereditary in nature, but some may be degenerative, such as age-related macular degeneration. Multifocal electrotachnography is also useful for identifying macular dysfunction in otherwise healthy retinas, revealing early evidence of drug toxicity or location functional injury. The diseases of retina include vascular-related disease, degeneration-related disease, tumor, and others. Vascular-related disease are retinal artery occlusion, retinal vein occlusion, diabetic retinopathy, and CSC. Degeneration-related disease are age-related macular degeneration, myopic macular degeneration, retinitis pigmentosa, Leber congenital amaurosis, retina tumor. There are retinoblastoma and retinal angioma. Okay, that's all for these lessons. Thank you for your attention. See you next time.